Welcome to Mulready Minutes with Oklahoma Insurance Commissioner Glenn Mulready. This is a podcast about insurance for insurance folks, risk managers, and business leaders. We'll dive deep, examine what is and isn't working, talk to leaders in the industry, and keep you informed on what's happening in Oklahoma and around the country.
Hi, I'm Glenn Mulready, Oklahoma's Insurance Commissioner, here with another Mulready Minute podcast, and it is that time of year, open enrollment time, and so that's our topic to tackle today. Special guest today, Mike Rhoads from the Oklahoma Insurance Department. So, Mike, why don't you just introduce yourself quickly?
Thank you for the invitation, Commissioner. I am in my 15th year with the department. Prior to that, there's another 25 or 26 years in the insurance business, health insurance business specifically. So rather than give you my age, I've been in the business about 40 to 43 years.
Yeah. Good. And I will just say, Mike brings a wealth of knowledge and expertise to the department that we are very grateful for those 15 years and certainly for my 7 years. So thanks for being with us. Started with it's that time of year, and it's a busy time for you and your team. Open enrollment for the marketplace for the Affordable Care Act individual health insurance starts Saturday, November 1st. So we are just days from that. We do have some changes coming this year, so maybe talk about some of the different changes that what is someone going to see when they go on November 1st?
Well, we have, I've been characterizing this as driving through a fog because what the consumer will ultimately see is rate increases. Mm-hmm. And rate increases have happened, they've been filed with the department and they've been refiled, they have been pulled back. So we're at a point here so close to open enrollment where we now have these final numbers ready to be seen by the consumer, and they will see some rate increases, in some cases rather substantial. And we want to talk today about kind of what makes up those rate increases, because at issue here, as we enter into this 30th day of the government shutdown, essentially over the enhanced premium tax credits that have been in the news and will be expiring at the end of the year. This is one of the drivers, one of the inputs to these rates, but it's not the only input. So we're going to talk about that today. But what the consumer will see is 7 carriers operating in the Oklahoma marketplace, offering 200-plus plans, lots of options. What this really should tell everyone is that we have a competitive market here, notwithstanding the fact that rates are going up. And we know that because insurance is a renewable type of business concern, every year we have new changes that have to be reflected in the rates. But we have over 200 plans. We will tell the consumer that they should be receiving, although it will be late in their mailbox, what's called a MOEN letter. That's Marketplace Open Enrollment Notice. That will be coming from their carrier and also from the marketplace. So this will give them instructions on how to navigate through this open enrollment period. And one of the new things here, we don't have auto re-enrollment this cycle. So they will have to go out and update their profile at healthcare.gov. And when you update your profile, you talk about how many people are in the family, if you have a family plan, what your income level is, other variables there, whether you are a tobacco user and things of that nature. But anyway, that will instruct the consumer to go out to healthcare.gov, update their profile, and hopefully, although we haven't seen it yet, because typically we have what is called window shopping, where the consumer can go out and look at their current plan, see what the perhaps the change in premium is, and make some decisions for themselves.
Yeah, not enroll yet, but look and see.
That's exactly right, and that's why they call that window shopping. We don't have that availability this year. So what they're going to do is be able to go out, update their profile, and hopefully there will be after you update that, what these subsidies will look like that will help offset some of the cost and the rate increases that they're going to be seeing.
Yeah. So you mentioned a couple of things that I want to kind of just highlight or emphasize. One was the number of choices that folks have. We have 7 insurers out there to choose from, which we are thankful for. So we're starting with what we're thankful for here, I guess. But,
yes.
When I came in office, we had 1. We now have 7, so we do have choices. And each year we've seen most of those insurers sort of expand their territory a little bit. So they're reaching out into additional counties. So that's a good thing. Lots of options for that. But you also mentioned the healthcare.gov. And so I think it's important to point out that we currently use the federal marketplace, along with, a little over half of the states out there. We are moving towards, slowly, a state-based exchange, which will give us a little more control, a lot more data, but that's down the road. But currently, we're still using healthcare.gov, along with at least another half of the states out there. The subsidies, the tax credits, it's part of the big conversation at the federal level. Everyone's maybe hearing about it for the first time, really what that means. The enhanced premium tax credit, what? And so take a minute to talk about, I guess, they were implemented in 2021, intended to be temporary, set to expire, renewed or extended in 2023, and set to expire December 31st of this year. But I know there's a lot of confusion out there that all the subsidies are going away, or some of them. Talk a little bit about the different subsidies and what's happening.
Yeah, essentially up until this point, through 2025, we've had 2 levels of subsidies. One is the original subsidy that came along with the ACA when it was implemented in 2014. That subsidy will stay in place. What we're talking about here is the expiration of the enhanced subsidies that came about with the American Rescue Plan and then the Inflation Reduction Act. And these were temporary. These were always intended to be temporary. So certainly for the past 3 years, we've had this enhanced premium tax credit that's out there. Congress knew that there was a sunset on this subsidy.
They knew that was looming on the horizon.
And, and has really kind of put it on the back burner. There could have been activity related to stepping that down as it would expire. And I think you've been an advocate of that, not necessarily having this cliff where these drop off completely, but having a schedule where it could come down gradually and not impact individuals completely. So enhanced premiums tax credits are going away at the end of the year, and as of today, they're off the table. Mm-hmm. We have no indication that they will be renewed. We know that there is lots of discussion in the Senate right now, and perhaps we will be surprised between now and November the 1st that there will be a change on that. But it doesn't look likely at this point in time. So we have a situation where this will have the enhanced premium tax credits have allowed people to have a 0 premium or even a very low premium amount, depending upon their income level. There's lots of inputs there. But, even with the expiration of these enhanced tax credits, our early review of this will be that there will be plans available certainly under $100 and even into the $50 range. And because we have 3 metal tiers out there, that's the catastrophic, the silver, and the gold, consumers can select, depending on what their price point comfortability is. They can go down to a very low premium, even with the expiration of these enhanced premium tax credits. But I also want to talk about what the other inputs are as we develop base rates. We know that the subsidies are an input on that, but there are other considerations here, one of which is acuity of this risk pool. And acuity really is how frequently the participants in this risk pool use services. People get sick, they go to the hospital, they go to their physician or whatever. The acuity factor is part of this input, and then also morbidity. And particularly in the older population, we have folks that have comorbid conditions, whether that be diabetes and a heart condition or whatever. That is a major factor also. So when you combine all of these inputs, the loss of the enhanced premium tax credits could easily be accounted for 8 to 9%. We have a trend factor, which is inflation, which is another 8 or 9 or 10%. Then we have the acuity and the morbidity factors that go into this. All of these inputs are raising these rates, particularly for 2026. And it points to one very important issue, and that is the ACA marketplace has got some fundamental issues with respect to risk and where it is. Certainly the enhanced premium tax credits have masked part of this issue. And as it goes away, it is more evident than ever as people look at these premium rate increases.
Yeah. And I think the message there is everyone's hearing a lot about the tax credits and the subsidies going away. That absolutely is a component of the increased cost to the individual. However, the larger cost is just rising healthcare costs when it comes to those rate increases.
Indeed, it is, Commissioner. And you know, you can't get away from it. In all of these cycles that I have observed for the last 40 years, every year, because health insurance particularly, and even other lines of business, it is a short-term business function. Each year, even on homeowners or commercial insurance, property insurance, there are changes there. There are new inputs to that. So we refresh these factors every year. We have to do this certainly on the health side.
Yeah.
And that's what we're seeing partially increase these rates.
Yeah, and our concern is that we know when folks in a matter of a few days go to enroll, they see the increased cost. The ones that are going to say, yeah, I'm not going to pay that. I'm going to go uninsured. We know those are going to be the younger, healthier people, which without getting in the weeds of insurance, that really taints that pool a bit and really hurts that pool. So we've got to figure out in a bigger, broader sense, how do we keep young, healthy people insured and in that pool? So,
yeah, and there will be options available even for the younger individuals in the ACA products if they have not already gone down to that catastrophic plan, which has a high deductible. There's no doubt about it. But it is called catastrophic for a reason, and that is you're in a car wreck or you have a medical condition that really involves a lot of services and treatment and whatnot. It is a catastrophic plan, and those will be lower priced. So we encourage even those individuals to look at, evaluate what they're comfortable with respect to a premium level. Stay in the risk pool, protect yourselves, protect your financial ability to pay if indeed you go into a catastrophic health condition. Evaluate benefits. Look at networks, because networks are very important here. We know that the 7 carriers in the marketplace are not in every county in Oklahoma. We only have one company that is statewide, 77 counties. The rest are situated in counties where they have built provider networks, and they have those availability plans in those counties. So we ask people to look at your price point, evaluate networks, your providers, and then go to that enrollment step, which is the guidance there will be to update your profile. And if you need help, we've got ways to help you. You certainly can call the Oklahoma Department of Insurance, and we can give you guidance. Now, we will not necessarily do a lot of comparisons for you. There are other entities that can do that. Agents and brokers are obviously, if you have a trusted agent and broker, go to them, ask for help. There is also the navigator, the federal navigator that operates here in the state of Oklahoma, and they can offer, assistance with respect to evaluations and whatnot. And if you don't want to use any of those, you can call healthcare.gov. And we will post telephone numbers and access numbers on our website to help consumers with all these options.
Yeah, good. So just in wrapping up, one thing I want to just point out, it probably goes without saying, but those subsidies that we're talking about, those are driven by the size of the family and their income related to federal poverty level. So that's what drives those subsidies. You've hit on a couple already, Mike, but as we close out here, you're a young family. I don't know, dad's self-employed. They've been on the marketplace now. They go in a few days and they have a 40% rate increase. Do you have a couple of other tips for them as they kind of look around, or what advice would you give that you haven't maybe already given?
Yeah, I think the advice that we give them is, once again, you see that large rate increase. Let's evaluate. You have to stay in the program. Let's evaluate where you can go in terms of a different product offering, whether that could be a different metal tier. If you're in gold, let's go down to silver. If you're in silver, let's go down to a catastrophic, but it's important to do that evaluation. Networks are important here for this family. The kids' pediatric doctors and mom and dad's healthcare providers. But the important thing is evaluate, look at networks, and look at opportunities to stay insured. We have other opportunities for people if they decide to leave the ACA marketplace. You can go to a short-term medical plan also that we certainly have available here in Oklahoma. The one thing that we're concerned about, Commissioner, is how many people are going to leave the risk pool. And, I can give you a range. We don't know what this will be. We'll look at it in probably 3 or 4 months. But this can go from 20% loss of this membership of 300,000 Oklahomans up to 40% of this 300,000. So that's between 40 and 90,000 folks may leave the marketplace. This will then have rippling effects across the spectrum of healthcare, and that will be perhaps some uncompensated care in our hospitals and our clinics and whatnot. That's a dramatic change from where we are now with only an 11% uninsured rate. This could easily go up to 15 to 18%.
Yeah, I'm glad you brought that up. I've talked a lot about that with our state and federal leaders, just the ripple effect of this. And we've got 80 rural hospitals, and depending on who you talk to, 40 of those are, in danger financially, just the impact that might have on them. But all that said, that's a lot of information. We want to make sure folks know that our team is there to help. Our consumer assistance area, as you've mentioned, 1-800-763-2828 for us. Contact an agent or broker, or also potentially connect with a navigator to help get through that process. So folks need to be covered. We want to make sure everyone can get the coverage they need. And Mike, thanks for being on with us and dispelling some of the things that are out there and clarifying what's happening and even what's being talked about at the federal level, including the government shutdown. Thank you.
Maybe the fog will lift here in a couple of days and we'll have some better answers.
The clouds will part. And
yes, there we go.
Angels will sing. Okay. Thanks, Mike.
Thank you.
All right, that wraps up this edition of the Mulready Minute Podcast. Thanks for joining us. A lot happening in the health insurance space as we are entering that open enrollment time of each year. So thanks for joining us. We'll see you next time.
If you found this episode informative, please subscribe and share with your colleagues. Visit oid.ok.gov/podcast. Let us know what topics you would like to hear about. Until next time, take care from the Oklahoma Insurance Department.